What's up, guys? This is Shane. I'm at CrossFit ATR, and Tom, the owner of the gym, was telling me that a lot of people were talking about improving their shoulder range of motion, or they were having shoulder pain because they went too hard on something. So we're going to take two tools, the lacrosse ball and the foam roller, and show you a series of smashes or deep tissue massaging that you can do for yourself to get rid of shoulder pain and improve your range of motion so that you jerk better, lift better, pull-ups, push-ups, all that improves. So the first thing to do is to get your thoracic spine more arched, more extended, the upper back. So to do that, you can just roll up and down, or put your butt on the ground and arch and extend back and forth. For more leverage, you can go long arm position like this. Now it's just going to be a little bit more intense. You teeter-totter back and forth, or you roll up and down. That's probably the first thing to fix when someone's complaining about shoulder pain. The next thing to do is get after the lats right here. So you lay on your side, the cross ball goes right up here into the lats, arm is up about this high. You just kind of roll around, getting anything that feels junky or ugly or tight or dense back there. After that, you go out to the side of the shoulder from here to here. This kind of posterior deltoid, the rotator cuff attaches in here, a couple other things. See what you find in there. And then we're sneaking our way to the side of the shoulder, hand down like this, and you're just kind of peeling across the deltoid, the side of the shoulder for a little while. If there's nothing here, move on to the next spot, being the rotator cuff right on the shoulder blade. How you can tell you're on the shoulder blade is if you go in this high five position where my head and the back of my hand is on the roller, and I move my shoulder around until I find a spot that kind of makes me jump. That's where you want to stay. Just get some pressure. You can turn into it, kind of just peel it apart. That's your rotator cuff, your infraspinatus, one of the rotator cuff muscles. Infraspinatus, infraspinatus, one of the two, anyway. And then after that, you're gonna go to the front for the pecs and the anterior delt. The way you do that is you go hand behind the back, right here on the front. If you do lots of dips or push-ups or pressing, this area gets really tight and it can limit your range of motion. So you're gonna go right here, forehead on the forearm, peel across here until you've cleared that area up, and then you go from the front of the shoulder to the pec. Lastly, hand still behind the back, you peel that apart and find whatever's junky in there, clean it up. And then after you've done that, test some kind of movement you care about. Test your push-ups, your presses, your pull-ups, whatever you've been having trouble with, and see if it's improved. That's it, guys. Check it out. Talk to you later.